Hi, and welcome to Naloxone Administration, Reversing the Effects of an Opioid Overdose. My name is Jennifer Goulet, and I am the Recovery Support Manager at the North Country Health Consortium, working with direct service staff within the Ask Petra Substance Use Disorder Support Program, which includes the Wellness and Recovery Model, or WARM program, and the newest extension of services, WARM for Women. By the end of this presentation, you will understand what naloxone is, be able to identify an opioid overdose, understand the necessary steps to take during an overdose, understand how to store naloxone, be able to administer naloxone and rescue breathing, receive tips for what to do after an overdose, and be able to identify where you can get naloxone in the North Country. So let's get started. What is naloxone? Naloxone is the opioid overdose reversal medication, most commonly known by the brand name Narcan. It comes in different forms, including two types of nasal sprays and an injectable. In this presentation, we will be learning how to administer the nasal spray, as it is the most common type distributed. Naloxone is not known to have adverse health effects if used on a person that appears to have experienced an overdose, when indeed no opioids are present in the unconscious individual. It will only work on a person experiencing an overdose and cause no harm to those not experiencing an overdose. It is also important to note that naloxone will only work on opioid receptors, so it is not effective against other types of substances. Now that we understand what naloxone is, let's look at identifying the signs of an opioid overdose. While there are many signs and symptoms of an overdose, the following signs are the easiest and most common to identify. A person experiencing an overdose may exhibit all or some of these signs. This may include a loss of consciousness, being unresponsive to outside stimuli, such as not responding to their name or a touch. They may be awake but unable to talk. Opiates depress the central nervous system, and that includes breathing. Breathing may appear erratic, slow, and shallow, or the individual may have stopped breathing. For an individual with a lighter skin tone, the tone may appear a bluish-purple color, and for those with a darker tone, it may appear gray or ashen. You may observe choking sounds or gurgling noises. This is sometimes referred to as a death rattle. Other common signs include vomiting, pinpoint pupils, a limp body, pale or clammy skin, and the fingernails and lips may change tone. Often, the heartbeat is slow and erratic, or there may be no pulse. It is also common to observe the surroundings for paraphernalia, such as syringes, cookers, cotton, and other materials used to administer opiates. Once you have identified an overdose and decided to administer naloxone, there are necessary steps to take. First and foremost, your safety should be considered above all else. If you are in danger, you cannot help others. Do not touch any paraphernalia. Clear the area of onlookers when possible. Call 911 or instruct someone else to call. Calling 911 should always be your first step. Please do this before administering naloxone. The sooner that emergency services arrive, the better the outcome for you and the individual. It is important to stay on the line with emergency services. Tell them what you are doing and comply with any instructions that they give to you. It is also important to note that naloxone causes an immediate withdrawal off the opioid that caused the overdose. Withdrawal is an unpleasant feeling, and individuals coming out of an overdose situation in immediate withdrawal may become angry, combative, or unpleasant. Once naloxone has been delivered, please keep a safe distance to continue ensuring your safety. To administer naloxone, you need to understand how it is given. As always, before anything else, call 911 and ensure your personal safety. Remove the naloxone from its package and prepare to give the dose. Naloxone is given by placing your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Your fingers will act as a buffer to guide for how far up the nostril to place the nozzle. Tilt the person's head back and provide support with your free hand under the neck and gently place the naloxone nozzle into the nostril. Once these steps have been completed, press the plunger firmly. After the naloxone has been administered, remove the nozzle and discard. Now that you've given your first dose of naloxone, the necessary steps continue. Position the individual in the recovery position. The recovery position is achieved by placing the individual on their side, head tilted back with one hand under their head for support, and one knee bent to prevent rolling. This position will help you to open the airway and prevent choking. Now, watch the person closely. If the person does not respond to the first dose of naloxone by waking up to voice, touch, or beginning to breathe normally within 2 to 3 minutes, you will need to give them a second dose. You may want to attempt a sternum rub before administering the second dose. A sternum rub consists of using your knuckles to firmly rub the sternum. It is known to provoke a pain response and may prompt consciousness from the individual. Naloxone can be safely administered every 2 to 3 minutes if it is available. At this point, you may need to give rescue breathing. If the naloxone does not cause the individual to respond and begin breathing normally, it could be necessary to give rescue breathing. If a CPR mask is available, please use it to protect yourself from any potential communicable diseases. Rescue breathing is simple and does not require chest compressions. Begin by pinching the individual's nose to close the nostrils and open the airway by tilting the head back and lifting the chin. Once the airway is open, take a deep breath and seal your lips around the outside of the individual's mouth to create an airtight seal. Now, give 2 full breaths for 1 second each. Remove your mouth from the individual's mouth between each breath to inhale. Watch to see that their chest is rising and falling with each breath that you give. This indicates that you are effectively administering rescue breaths. Continue rescue breathing until emergency services arrive, an automated external defibrillator is applied, or you can no longer continue. After naloxone is administered, there are still necessary steps. The effects of naloxone wear off in the brain and body before the effects of the opioid that caused the overdose. For this reason, it is important that the individual waits to use substances again to prevent another overdose. The individual should stay with another person for at least 2 hours. This way, they can be watched for additional concerns and receive medical care if necessary. Naloxone should be replenished after it has been used. Get a replacement kit. Finally, experiencing an overdose can be a traumatic event for all involved. It can help to talk about it with someone that you trust or a professional. What else do you need to know? Well, naloxone is a medication, and like all medications, there are special considerations, such as storage and refilling a prescription. Naloxone is temperature sensitive. It is best to store at room temperature, ideally between 59 and 77 degrees. Anything above or below this temperature can cause naloxone to degrade and be less effective. The temperature in your vehicle is not stable. Do not leave naloxone in your car. Refilling the naloxone prescription is simple. It expires every 2 years, so refill close to the expiration date. If the kit is lost or if you have used at least 1 dose, these are ideal times to obtain a new naloxone kit. Naloxone does not require a prescription, and anyone can obtain a kit at any time. Purchasing naloxone can be costly, but there are initiatives in place to make naloxone available to everyone. This brings us to our final consideration. Where can you get naloxone in the North Country? Due to initiatives to increase naloxone access, there are multiple options for obtaining naloxone. You can buy it at local pharmacies, but you can access naloxone at no cost through your local doorway programs as the state of New Hampshire's point of distribution by calling 211. In the North Country, The doorways are located in Berlin and Littleton. You can call the doorway at Androscoggin Valley Hospital or the doorway at Littleton Regional Healthcare and request a kit. You can reach out to Ask Petra to obtain naloxone as well. The Ask Petra Save One Life campaign provides outreach and education kits, which include naloxone, fentanyl test strips, a disposable CPR mask, disposable gloves, alcohol prep pads, and important information for what to do after an overdose, how to use naloxone, using fentanyl test strips, accessing HIV testing sites, and connecting with recovery support. Kits can be requested online at askpetra.org or by reaching out to the Ask Petra staff. There are multiple ways to connect and request a kit. Save One Life outreach and education resources can be requested by calling 603-259-1729, texting 603-259-4820, email askpetra@nchcnh.org, or access the web chat feature on the website. To request an organizational training on naloxone administration or to access naloxone, please contact Ask Petra. For questions regarding this presentation, please reach out to me, Jennifer Goulet, at jgoulet@nchcnh.org. Thank you for your participation in this webinar, and congratulations on taking this step to save lives in your community.